Well, let's talk about the education. When we talk about the education, what is the route in India? How long does it take? And I'm guessing it's pretty similar in Pakistan as well. The time it takes a student from leaving the or leaving the this what's it called, 12th grade or A levels, and then that pathway and the similar pathway in UK. What are the differences?
Okay, so first of all, like a word of advice, or to the next generation, or to aspiring doctors, or to medical students, that medicine is a long journey, and you are in it for the long run. So you have to enjoy what you do, and be positive about it. It's not a sprint race. You're not going to sprint through it. It's too long. It's whatever you do is going to take you way more than a decade to be a
Wow.
consultant. And I think you have to have that patience and understanding. If you are doing medicine, or if you are aspiring to do medicine, I think you have to understand that this career choice is something quite different to your colleagues. If you look at your colleagues who are doing finance, architecture, or other kind of business management or so, your education is going to be longer than them. It's going to be quite long, so you have to be patient. To succeed, you also require different qualities of good communication, human interaction at a personal level. I think, of course, everyone should be good in these things, but I would just like to re-emphasize that you are in it for the long haul. It's going to be much beyond a decade from the time that you start studying till the time that you specialize, and it's a long journey. So you have to be patient. And I think the quest of wanting to do medicine is about being a good human being a good communicator, empathetic. Of course, you need the technical skills. Definitely, you need technical skills. If you're a surgeon, you need surgical skills. If you are an endoscopist, a physician doing procedures, of course, you need the technical skill set to do the relevant procedures in your specialty, whether it's endoscopy, whether you're a cardiologist who wants to do cardiac catheterization. Of course, these skills are important, but you should be a good empathetic, caring human being, good in communication, good technical skills. And I think your aim should always be to, heal someone by the way that you have a caring nature and explain things and be empathetic in your response. I think these are inbuilt criteria that are important to succeed. And somehow I think, with the current focus being so much on AI and technology, I mean, don't get me wrong, these are important things. Of course, we have to use the diagnostic tests and the advances in technology to our benefit, but this shouldn't replace our communication skills.
Absolutely. Okay. So going back to the question was the duration it takes.
So the duration, I'll put in India, people first do MBBS. I think it's around 4.5 years, followed by 1 year of internship. So that's 5.5 years at least. After this, there's a very competitive process where the doctors have to sit for entrance exams like the National Eligibility Entrance Test to do MD or MS. They have DNB entrance exams, which can be an alternative. These are very competitive. I mean, broadly speaking, again, I speak from personal experience, which is a long time ago, but by and large, the exams are very competitive because there are people like over 1 lakh or over hundreds of thousands of people, at least 80 to 100,000 people giving the exam, and there are a few thousand seats. So it is a very competitive process, no doubt. And not everybody gets seats. And there are sometimes people who repeat their attempts in the next year or the next to next year as well, so that they have had more time to prepare. So it makes it difficult and challenging. It is a very competitive process. And yes, when the student gets a particular rank in the entrance exam, then the allocation is done based on their preference for the location and based on their specialty. And based on that, they can get allocated a seat. Conventionally, there used to be MD and MS, but in the last 10 to 15 years, DNB is another form of post-graduation. It is equivalent to MD or MS. It is just a different degree. And DNB is awarded by the National Board, which is in New Delhi. MD and MS usually can be awarded by a state level university. I mean, for practical purposes, they are the same when you practice in India, but these are the different ways. So if there are some branches for which there is specialization, like a 3-year MD or a 3-year MS, followed by super specialization. And there are some branches for which the 3-year specialization is a terminal branch. So to put that into context, a branch like dermatology MD dermatology or DNB dermatology makes you a specialist after 3 years. Whereas if you do an MD in general medicine or an MS in general surgery, you then have an option to pursue a DM, which is super specialization in, suppose MD medicine in India can then do DM cardiology or neurology or gastroenterology or cardiology or hematology or oncology. Likewise, MS general surgeon can do various subspecialty, super specialized surgical training in MCH like neurosurgery, pediatric surgery, thoracic surgery, cardiothoracic surgery, various types of surgery. So, whereas orthopedics MS would be more of a terminal branch. And of course, things are changing. In the current times, everybody has an area of interest, and most people, even if they do a terminal branch, like say, for example, they finish their MD or MS and they don't have an opportunity for DM or MCH, then they land up doing fellowships, sometimes in India, sometimes in excellent apex institutes in India, sometimes they go abroad to get certain different systems exposure, be focused in one or two particular subspecialties or certain procedural skills which they want to enhance.
Okay. So how does that process compare to?
Correct. So that's 5.5 years of MBBS plus 3 years of specialization. That's assuming one gets into that entrance exam in the first go, then that's 8.5 years. But various states, when you do MD or MS, sometimes certain states in India, they require you, they have something called as a government bond, meaning once you do your post-graduation, they require you to work in that state for 1 or 2 years. This, again, conditions apply. Every state has different rules. So the reality is it can add 1 to 2 years to your education because you have to work them. You do get salary for that. But basically they want to ensure that the doctors work in that state, in that hospital or adjacent hospitals to look after the patients for some time. So the minimum we are looking at is 8.5 years plus if there is any what you call as postgraduate bond to be served. And this is assuming the student cracks the entrance exam for MBBS and post-graduation in the first go, which is a very tall order, to be honest. Realistically, most people would need like at least one more attempt at it. But again, this is the bare minimum. If one were to do a branch like say MD general medicine or MS general surgery, and then they wish to do a DM cardiology or say a MCH in cardiothoracic surgery, that would add another 3 to 4 years to the process because they would have to give another entrance exam after their MD or MS. And if they get a rank, then they would need to spend another 3 years for that. And then again, depending on the institute and the state rules in India, they may have to serve for 1 year as part of the government bond. So that would then make it about 12 to 13 years if they chose such a branch. So the answer to your question, yes, the minimum would be like 9 years. It could be up to 12 to 13 years, including somebody who does super specialization with DM or MCH. But this is assuming a rosy picture that this is a student who gets through everything in the first attempt, including the daunting entrance exams. Whereas it may not be for everyone that this happens in the first attempt.
Okay. And the process in UK, is that similar or is it shorter?
The process in UK is also long. I mean, in UK, again, the MBBS is again 4 to 5 years. Now they are coming up with slightly different courses which are changing and they are announcing slightly shortened courses. But then the student has to have done certain different graduations, certain qualifications after their A-levels before they enter medicine, and they may possibly have a shorter duration. These courses are being worked out, but conventionally, yes, the MBBS duration is similar. After doing their MBBS, they have 2 years of foundation training. That's foundation year 1 and foundation year 2. So the end of foundation year 2 is sort of equivalent to the end of internship in India, broadly speaking. Then after the foundation year 2 commences, conventionally the options have been to do medical training, like somebody who wants to do medicine, or they could do surgical training, or if they want to do anesthetics. These are broadly speaking been the options. Again, you have various subspecialties of medicine, surgery and anesthetics. Usually speaking, the specialty training takes around 7 years. Around 7 years. So if one, after the internship completing, it's at least 7 to 8 years because when you start, it used to be called core medical training and core surgical training. Now the word is internal medicine training. So I'm speaking as a physician, I'm a respiratory and sleep consultant, so I speak more as a physician, but broadly speaking, this does apply to surgical specialties and anesthetics as well. So say if you want to be a physician, after doing your MBBS and finishing your foundation year training, there is 3 years of IMT or internal medicine training. Following this, there is specialty training where you start from ST4 till ST7. So that's another 4 years. And that, for example, if you want to do respiratory, cardiology, neurology, gastroenterology. So this is the pathway. This is 7 years. Again, this 7 years is assuming that one works full time, one gets all the requirement outcomes every year, to make sure the Royal College and the university grants them the achieve standard for every year. They pass all the relevant exams, they work full time, they don't take a career gap.